Well, hey guys, in today's video, I'm going to be talking all about my thoughts on the TikTok viral trend of skin cycling. But before getting into it, make sure you're subscribed if you like skincare content from a board-certified dermatologist, and hit that little bell icon. By turning on your bell notifications, YouTube will let you know as soon as my videos go live. If you're not on TikTok, you may not be aware of this, but there is a trend going around of something called skin cycling. It was actually started by a dermatologist over on TikTok, Whitney Bowe. And basically what it is a way to alternate or cycle your skincare products on different nights of the week so as to minimize irritation. On the first night, you use a retinol. On the second night, you're going to use an exfoliant. And the third and fourth nights are referred to as rest and recover. They focus around moisturizing, using hydrating ingredients. And the goal here is to use these ingredients in such a way to minimize irritation and dryness. And on a platform like TikTok, where there is so much misinformation, heavy, you need, I'm obsessed, run, buy this right now, it's very easy for people who are consuming skincare TikTok to get overwhelmed, buy too much stuff, use too much stuff, and end up with a lot of irritation and dryness. And if you've watched my videos on ingredients not to use together, you know that the combination of retinol and exfoliating acids applied at the same time can lead to a lot of irritation for people that worsens dryness. It can cause a kind of irritation that for people with deeper skin tones can put them at risk for hyperpigmentation that becomes very stubborn to fade. It also can aggravate people's acne. As a matter of fact, a common complaint people deal with when they start, say, a retinol is that they're getting so much irritation that their acne is actually getting worse. A lot of people think that they're purging, when in reality, it's just that their skin is too irritated. If you have a history of eczema or you have rosacea, this really can put you in the house of pain too. All of this irritation can leave you in the house of pain. You know, the skincare market, it is so saturated with a variety of different products, retinols, hydroxy acids, all sorts of active ingredients. It really is a tricky territory for consumers to navigate, and honestly, I don't think that skincare brands do an adequate job on their instructions counseling people how to use their products and what things not to use them alongside with. So all of that to say, you know, this is a really popular trend over there right now, and I get a lot of questions. What do you think of skin cycling? Is it good? Is it bad? Should I be doing it? Here's the thing. I think in the landscape of TikTok, skin cycling is a way to simplify and reduce all the noise and help consumers introduce these ingredients into their routines so as to minimize irritation. It's a safe and straightforward approach. If you've watched any of my videos on how to start a retinol or how to exfoliate the skin, I always encourage people to go very slowly with introducing these ingredients because they can lead to a lot of irritation. It's not uncommon to hear recommended either online or from your dermatologist to introduce a retinol very slowly. Start using it one night a week and then gradually increase to every other night, and then nightly as tolerated. This approach is kind of some version of that. However, this approach also layers in using an exfoliant. While I think this approach is very safe, I don't think that this approach of skin cycling is the best thing for everyone. Most of these products, you can get a lot of benefit from using them on a daily basis. Retinol, for example, is intended to be used daily as tolerated. By sticking to this routine long term and only ever using your retinol every fourth night, I think you are potentially missing out on some of the maximum benefits of using retinol. Now, that's not to say that using retinol this infrequently has no benefit, but for certain things, you're going to get better results using it more frequently. It depends on what it is that you're dealing with. For things like acne, hyperpigmentation that you may be trying to improve upon, using it more frequently is probably going to be a better bet for a lot of people. There's no universal truth. Remember, everyone's skin is different. Your individual skin needs are all going to be different, so there's not going to be a one-size-fits-all approach in the long run. There are a lot of benefits that can be had from using a retinol. Not only can it help impart some acne control, and in the case of the over-the-counter retinoid adapalene, it is an FDA-approved acne treatment intended for daily use. It's very mild and very gentle. So for things like acne, hyperpigmentation, I do think going at the snail's pace, it's going to take a very long time and is just unnecessarily dragging things out. Now, a lot of people will say, well, I can only tolerate using my retinol 1 night a week. If you can only tolerate using a retinol 1 night a week and you've been using it for greater than a month, it's probably just too irritating for you, and either switch to another product, or in the case of the prescription stuff, definitely give your derm a call or follow up with them, because in the case of, say, tretinoin, for example, it may be that you would be better served by a lower percentage strength, or you would be better served by another brand of the active retinoid, whether it be tretinoin or the other prescription retinoids, tazarotene, for example. You know, different pharmaceutical companies, they have done tweaks here and there to their retinoid formulations to make them easier to tolerate. So when we're talking about tretinoin as a prescription treatment, I think most dermatologists would rather you be with a retinoid that you can use on a daily basis without irritation than one that you're only using once a week, because for treatment purposes, that's just going too slowly. Retinol takes some time to start working. So if you're going at the snail's pace indefinitely, then it's going to take a very long time for you to derive those maximum benefits. And when we're talking about a skin condition like acne that heals with hyperpigmentation and or scarring, that's just going to be too long. So it's not going to be right for everybody. Let's talk about the exfoliating piece of things here. With skin cycling, again, night 1 is retinol and night 2 is some sort of exfoliant. You guys have heard me say this ad nauseum, but if you're new here, not everybody needs to use an exfoliant. I think marketing around exfoliating products has led consumers to believe that an exfoliant is something we all have to be using and that we all need, but in reality, your skin exfoliates naturally on its own. You don't necessarily need an exfoliant. And for a lot of people, not only is it unnecessary, but it can be irritating to them. Now, I have videos on how to exfoliate, what types of exfoliants to use, depending on your skin type, skin concerns. But again, not everybody needs to. People who benefit from an exfoliant are people who are looking to improve the look of hyperpigmentation. Alpha hydroxy acids certainly can help improve the look of sun damage and may improve the look of wrinkles and fine lines with long-term consistent use. And they may actually augment the effects of retinol. Salicylic acid is an exfoliant that benefits acne. But if you have skin and you don't have any underlying issues that you're looking to improve upon, you really have to ask yourself, what is the point of me exfoliating? If you're already using a retinol or a prescription retinoid, it's going to smooth out the surface of the skin, and it does that by improving the rate at which the skin cells turn over and by helping them behave more appropriately so you don't get clogging of the pores and dry built up skin cells. That is one way in which retinoids work. So there's a good chance that the skin surface is already smooth and that adding an exfoliant into your routine, it's not going to do that much. Exfoliants are a very broad category. You've got physical exfoliants, which I'm not such a fan of because they're not as precise as chemical exfoliants, and they can end up being pretty abrasive, especially for people who have a more sensitive skin type. Then you have chemical exfoliants, and in the category of chemical exfoliants, you have so much. You've got alpha hydroxy acids, which most commonly in over-the-counter products are going to be glycolic, lactic, mandelic, or some blend of those. Then you have salicylic acid, an FDA-approved acne treatment that's also beneficial for seborrheic dermatitis. You also have polyhydroxy acids, really gentle, ideal for more sensitive skin types. And across this gamut of just the chemical exfoliants alone, within each of those categories, alpha, sal acid, poly, you have so many different formulation types. And when it comes to the chemical exfoliants, the formulation overall really has an influence on the performance of the product. Some products, the manufacturer intentionally adds things to slow the penetration of the acid into the skin, and therefore they work much more slowly so as to reduce irritation. They're a lot gentler. So if you are using those types of products every 4th night, they're probably not doing that much for you. It's going too slow. Whereas other products are meant to be used less frequently, and maybe even the instructions say to use once a week. Talking about salicylic acid, you know, this is an FDA-approved acne treatment. Majority of salicylic acid products out there, at least when we're talking about for acne, they can be used safely, even twice a day. and they help to control the acne breakouts. They also are anti-inflammatory. So to say that the frequency of use of a salicylic acid and alpha hydroxy acid and polyhydroxy acids are all just going to be universally the same, universally for all skin types, indefinitely, forever and ever, amen. It's a country song, right? No. And you really can't just put exfoliants into that 4th day and generalize them, because there's so much variability from exfoliating product to exfoliating product. So much so that you can go into the drugstore, for example, and you can pick up a 10% glycolic acid toner from one brand and a 10% glycolic acid toner from another brand, and they're going to perform entirely differently in terms of exfoliation, just based on how they're formulated overall, the free acid values of these products, and other ingredients that are added that may slow or enhance penetration of glycolic acid into the skin. So you're going to get different degrees of exfoliation, different effects. They're going to work at different rates. And so the every 4th night thing, it may just be too slow. It kind of creates a little bit of room for more confusion for you if you do develop irritation, because you're basically introducing retinol and an exfoliant together in this drawn out routine. In my opinion, this is just my opinion, it's not a fact, but in my opinion, it makes more sense to introduce a retinol first and introduce it slowly. Get used to it, feel comfortable with it. Start once a week, increase to more frequently as tolerated, every other night, up to nightly. Once you're comfortable using the retinol, and you've been using it comfortably for at least 6 weeks, ideally 3 months, because these things take a long time to actually start working. Once you're patient enough and you've been using it consistently enough for, again, 6 weeks to 3 months, then you might want to consider the benefits for you of introducing an exfoliant. Do you even need to at that point? At the end of the day, skincare and skincare routines, they are very individualized. This approach of skin cycling is very slow, which offers the benefit of kind of simplifying skincare for people who maybe are skincare overloaded from the internet, and it offers the benefit of having these ingredients in your routine while safely reducing irritation. Doesn't completely eliminate the risk, however. The other piece of the skin cycling is the recovery days, day 3 and day 4, where you're basically focusing on just using moisturizers, and that's great. You know, moisturizers are really helpful for all skin types. They help reduce water loss from the skin. They can help make it so that products are less irritating. In my opinion, using retinol, you should be using it alongside a moisturizer anyway, which, you know, this skin cycling doesn't say that you shouldn't. They just focus the day 3 and day 4 on moisturizing. No one skincare routine is going to be right for everyone. Skin is so variable. We all have different skin types. We all have different skin tones. We all have our own issues, things that are more likely to cause problems for our skin. You know, if you have a deeper skin type, certain ingredients may be too irritating for you, and that could put you at risk for hyperpigmentation. If you have a more sensitive skin type, if you have rosacea, for example, certain ingredients are going to burn and sting and can elicit symptoms of flushing, redness. That's not going to be good for you. Regardless of skin cycling or not, the frequency, you know, it doesn't matter as much. Exfoliants are such a broad category that it's very hard to generalize them into a one-size-fits-all frequency of use. In my opinion, skin cycling makes the most sense in the setting where, say you have a cosmetic dermatology practice and you have products in office that you sell that are intended to either enhance the treatments that you are offering, and you're selling those products and you're counseling patients on how to introduce these products into their routine in a safe and effective manner. These active ingredients like retinol, glycolic acid, a safe manner so as to minimize irritation. Then skin cycling makes some sense. You tell the patient, these products are intended to improve the visible signs of skin aging. We did some treatments today that target those things, and this is kind of going to be your maintenance that's going to work on those things as well. And this is how I want you to use them, because these ingredients can be irritating if you use too much of them or you use them too frequently. And I think, again, it makes the most sense if you have products in your office that you sell that you are familiar with. So we're talking about a limited a limited selection of products, as opposed to the whole internet where you have so many different skin types, you have so many ages of people consuming content, not only ages but skin ages, because skin age and chronologic age, they don't always match up. Different skin goals, and so many products that consumers have access to that it becomes very difficult to just generalize frequency of use for any one product. So I think it can be less than optimal for such a large audience, but it makes the most sense in my mind if you have a cosmetic practice, like I said, and you've got your own products or branded products or whatever that you're familiar with, and it's a limited selection, then it makes more sense to me. All right, you guys, that's my opinion on skin cycling. Seems safe, but again, skincare is not a one-size-fits-all approach. If you have a skin condition, whether it be eczema, acne, psoriasis, melasma, see a board-certified dermatologist for evaluation and treatment advice. Skincare is not a universal do this, do that cookbook approach, and so there's no one size fits all, but this seems like a safe way to maybe introduce ingredients with the caveats that I went over in this video. I hope you all enjoyed this and it answered your questions on my thoughts on skin cycling. Let me know in the comments if you have started doing skin cycling, if you've tried it out. Maybe it's working out well for you. Let us all know in the comments. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.